Hey everyone, it's Dr. Andrew Orr here. Today I'm going to talk about I suppose a very sensitive topic for a lot of people, and it involves talking around this. One of the things that I often speak to women about or get asked about is basically the tissue inside the vagina, the pelvic floor, and things that can actually help with what we call hypertonus through this area in here. And by hypertonus, what I mean is that when the muscles and the tissue and everything get too tight, they can also cause pelvic floor spasm and spasm through the vagina in that area as well. And that causes nerve excitability so that the nerves are like they're turned on all the time. Now, over the years, I've heard many stories, and a lot of women will go and try things like these little things. They're called these are like stone eggs, or they're known by many names like yoni eggs, stone eggs, fertility eggs, and there's all sorts of names for them. And we'll talk about that in a moment. When I'm part of the women's health experts that I'm actually part of, we have our own ones called the OVA, and OVA meaning egg. And I'll talk about that as well. But there are exercises like Kegels exercises that women can do as well. The one thing I talk about, especially with pelvic floor and bladder control and things like that, is that it's often shown that when we talk about the pelvic floor, which encompasses basically all the muscles that hold into the vaginal area, the tissue, the bladder, the bowel, and they all connect in together. A lot of people think that when they're doing their pelvic floor exercise, so a lot of women are taught to do pelvic exercise. Well, they may not be necessarily taught, but a lot of people will see tutorials and things like that. But a lot of the time when people think that they're squeezing their pelvic floor, it's been shown that about 80% of women are actually just squeezing their butt cheeks. And that, look, it's no one's fault at all, but a lot of people haven't been shown how to control that pelvic floor properly. So there are devices that we can show, or we get women to put a finger in, I suppose, and see if they can actually clamp it. And some can't. And some have got very, very weak pelvic floors and can't hold those things. So there's all sorts of apparatuses and things that they can use to assist with that. One of them is the Kegels balls. With the Kegels balls, we see a lot of women will go and get them recommended from their physiotherapist or pelvic floor therapists and so forth. But a lot of women are actually not liking those because they look quite plastic, and they do. They look, yeah, they're quite not really feminine looking. So the reason that a lot of people turn to these sort of eggs is because they look a lot more feminine, and a lot of women say they're a lot more discreet and things like that. The ones that we have, they come in, and especially for the women's health experts, they come in a couple of colors. We've got the dark amethyst and the jade. The rose quartz, I'm sorry, not jade, and throwing the eggs everywhere. So yeah, that's why a lot of women will get, and a lot of people that go to yoga classes or Pilates classes will be recommended. They've become quite popular in the last couple of years. Now, the other one thing I will say about them is that there have been celebrities and things like that making some very outlandish claims about these eggs, whether they call them yoni eggs or love eggs or fertility eggs or whatever they're calling them. And as I said, we just call them the ova. Is that they're making these outlandish claims of what they can and can't do, and they're saying all sorts of things, that they can cure things, and like it's producing mind-blowing orgasms and things like that. And the other part is where they're sourcing them from as well, because remember, these need to be hygienic. And so when we source through the women's health experts, we actually make sure that they're actually done properly and they're polished properly, and there's no way that bacteria can get into little crevices and cracks and things like that. So we have them specially made with high quality material. And the good thing about them is that once they're, you know, you wash them before you use them, you can wash them when you put them away. And they've actually, we get people to use the dental floss so that that can be taken out rather than the strings that come with them at the time, because all those things hold bacteria and you don't want that, anything that can hold bacteria. So these can be sort of put away discreetly and then no one knows what they are, and also it keeps dust. So I've seen people keep these things on their shelves and put them in with their crystals and all, and a lot of them are just getting them from crystal shops too, where people have handled them. And as I said, these are specially made, specially polished and specially done so that they can be used. But again, it's not about making any outlandish claims. So the way I often explain like why you would use something like this, or why women are using this, is that when there is something like an egg or like the Kegel's balls are put inside the vagina, it gives a reference point to clamp onto as well. So it makes it where you have to hold them in. So by using those proper techniques and making sure you are actually holding, because as I said, a lot of people think when they're clenching and doing their exercises that they're actually activating the pelvic floor. And as we all just said before, about 80% of people think they are, but they actually aren't. Which, if you go to a pelvic floor specialist, there's special machines and they can actually see whether you're clamping or not. And that's why it's important to see a pelvic floor specialist, by the way. Because if you think that you've got these issues. Now, the other thing I need to make very clear to people, that if you've got a prolapse or you've got something that needs surgical repair, then it needs to be surgically repaired. A lot of women put off going to have things like prolapses and that done. Again, we were talking about the hysterectomy side of things the other day, and they put off this just due to preconceptions that, you know, all these things and surgical interventions were like they were 20 years ago. A lot of things like prolapses and that now are easily repaired, and some small little ones can be repaired with just conservative management, you know, topical estrogen creams and things like that, and some pelvic floor work. But a lot of prolapses are going to need surgical repair, and they need to be done by a qualified pelvic floor specialist or a urodynamic specialist. And again, you need one of those surgeons, advanced trained surgeons that knows what they're doing. But getting back to it, at how these things may assist, I often say to people is that, you know, why we're seeing women turning to these things now and saying that they get all these weird and wonderful things, you know, all these, not weird, but, you know, all these wonderful results and so forth. And the reason is that, look, let's look at it logically. If you have, say, a pain in your arm or your leg, what are you going to do with it? You're probably going to see a massage therapist or a physio who's going to get in there manually, and by moving that muscle and getting the circulation going and bringing the circulation into there, and also pressure, it also helps all the nerve endings and the pain receptors and everything like that. You could also look at things like acupuncture and things like that on the outside, but how would you do that on the inside? But we've got to remember is that the uterus, the vagina, and all that surrounding reproductive organs, it's all tissue and muscle. And like every other muscle in your body, if you're not exercising it or you're not activating it, well, we get atrophy. So this is one of the things we see a lot with women when they go through menopause, especially, they get atrophic vaginitis. So atrophy means that it's starting to atrophy, and those muscles and that tissues is losing its elasticity, and then we start getting splitting, and that's why women get pain with intercourse and things like that, and bleeding and all kinds of stuff like that. So it really is that, you know, that use it or lose it response. So if we're not using our, you know, our muscles daily, or our legs or our arms and things like that, we get muscle wastage as well. And that can also, and then lack of circulation, that can lead to pain. Well, guess what? The vagina and the uterus and the whole reproductive organs, it's all muscles as well, especially. And women, because of all the taboo around, you know, in previous years of, you know, the sexual revolution, all this kind of stuff, we look at all these bits as it is taboo, you know, don't talk about it. It's, oh, you know, it's too sensitive a topic. But just remember, it's another muscle. So again, how these may work is actually by inserting and holding them and then moving with them and trying to exercise with them, you know, the clamping and, you know, for 5 seconds, let go, clamping and so forth. Or say you were doing a yoga class or a Pilates class where it's activating your core, which will then help activate this pelvic floor. It's just like having a massage inside there. Now, the one thing I say to people, these aren't sex toys either. Like while people say, oh yeah, they'll help increase orgasm, things like that. By increasing blood flow into here and helping with all the surrounding tissue, of course it's going to help with that. But then we get someone say, well, I've got endometriosis and I've got pelvic floor pain and I get pain with intercourse, or I've got atrophic vaginitis and so forth. If that's the case, if you've got atrophic vaginitis, then you need to go and talk to your doctor about things like topical estrogens and things like that that can help through there, or speak to a pelvic floor physio or a specialist and get some help through there. But some of the things, you know, like you're only seeing those people once a week. So this is where women are looking at things they can do for themselves. So this is what they could, what a lot of them are actually looking at now while using Kegel's balls or actually these eggs. So again, it's like using a massage. It's like having a massage, but internally. Now, so it's increasing that blood flow. It's damping down the nerve endings. So it can help, or may help. I shouldn't say always can. It may help and may assist with increasing the blood flow, and it may assist with dampening down those nerve endings and things like that. So it's like anything in life, you know, if that's what I would say to people, if someone said to me dirty dishwashing water would help, and they could show me that it helped consistently. And what I see time and time again is women saying that these things are helping them. So it's something that we need to talk about, but without making outlandish claims. And it's also explaining how they may assist. And again, it's more around that peripheral circulation, dampening down the nerve, and it's just like a massage. It's like an internal massage. And we know there's lots of research around massage and physical therapies and stuff helping with pain. Obviously, with any pain, there always can be an emotional link as well. So we've got to look at that as well. But it's something that we can sort of say to women to definitely have a look at. Now, like anything, before you start things, you should always talk to your healthcare professional before you start anything like Kegel's exercises, using some of these eggs or anything that you might be using internally. The other part that we like to talk to them about is about the hygiene aspect, especially anything that goes internally need to be washed before and after. And then they also might need some lubricant, like a water-based lubricant to help with lubrication. But it's like anything, the more that you get massage and the more you exercise the area, it's going to dampen down some of those pain receptors, and it's going to help with that elasticity. It's going to help with that circulation into that area as well, which then helps a lot with the pelvic floor and the toning of pelvic floor, which could then help with bladder control and things like that. And again, it's like any exercise. I've seen these things on, you know, people explaining these things that they leave them in all day and things like that. That's just ludicrous. It's absolute ludicrous. Things like that should only be put in for sort of 5-10 minutes at a time, and maybe only start off with that, and then maybe work up to half an hour, maybe 3/4 an hour tops. That's it. Like any of the massage. So if you're going to the gym, you don't sit there all day and do this, because you'll end up overtraining, you'll get an injury, and then it could be really, really, really bad. You don't do that. And any exercise you don't do all day. So I think that's why I've come on to sort of talk about that, is to more look at outlandish claims, but look at how things like this could be used to assist, and how they may assist, and how they could benefit someone with legitimate issues. And it's something that women should look at of all ages, especially after childbearing, when the pelvic floor area can lack that tonicity. And it's also an area due to, like I said, the discussion on sex, because it is a sexual reproductive organ. We don't want to talk about it. But it's like any other muscle in your body. It's a muscle. It needs nourishment. It needs exercise. It needs blood flow. It needs to be worked. And yes, normal exercise and exercises that work and activate your core, like Pilates and Pilates Reformer and yoga, and all sorts of other exercise do that. But if you're having trouble with pain and stuff through that, it could actually be used to assist in helping some of that pain and dampening down that with other sort of medical interventions and so forth as well. So I just thought I'd come on and talk about that. And usually when I explain it to people, I talk about, one, again, the quality of stuff you get, because there's a lot of crap quality things out there. A lot of people are getting their Kegels balls and these yoni eggs, or whatever they want to call them, on all sorts of places, and they're cracked and they're horrible. So you've got to look at a reputable source. Then you've got to look at all the outlandish claims and stuff that they can make around them, and be real about it, and then not overuse them, and also practice safe hygiene and everything with them as well. And like anything at all, before you start something, talk to your healthcare practitioner, or talk to a pelvic floor physiotherapist, or talk to a pelvic floor or urodynamic specialist, who's someone who's actually qualified in that area. Or, you know, go to your GP and say, look, I'd like to go to see one of these people. Because often, it's not putting GPs down, by the way, but GPs are general practitioners. And yes, they will have some idea, but they're not specialists. So you want to see a pelvic floor or someone who specializes in that area. Again, if you want to know where to get like I said, the women's health experts, we get them for the women's health experts. And if anyone wants to find out more about this and how they might be able to assist them, they can give us a call. My staff will explain that to them, and prices and so forth. And they also come with instructions. But like anything, I tell people, always talk to a specialist or someone first, or have a consultation with a women's health expert at first, and then go over that and make sure you know what you're doing. It's just like going to the gym. You don't go and jump on the gym and, you know, go exercising away, and, you know, next minute you're doing injuries. It's like that. The pelvic floor is the same. We don't want that. So I thought I'd talk a little bit about it, because there is some interesting topics out there when we see daily what women are being thrown at them. And then it's like everything else is, where do I go? How do I get these? What do I do? And a lot of people are left to their own devices, because celebrities and influencers and that, you know, influencers are trying to tell them to do all this stuff, and they've got no idea. They're not qualified people. All right, so I'll finish off with that. But if anyone does want to know a little bit more about these are called the ova. We prefer not to call them the yoni. So these are very, very, very different to some of these things you get on the market, and these are all properly made and made for those purposes. And they are used by women's health experts as well. So this is why it's very, very, very important to be careful, like anything, where you get your stuff from. All right, thanks very much for listening. And just remember that pelvic floor and that vaginal area is just as important to exercise and take care of as any other part of our body. And yes, me being a man talking about this, it's actually part of women's health medicine, is which I talk about daily. But it's like men as well, with prostate and things like that, whole sexual reproductive organs as well. It's just important for men to know about that, their reproductive organs and what they need to do to keep all their happy, healthy sexual functioning as well. It's just as important. That's why I thought I'd come on and talk about it. And we've talked about the vulva recently with the lovely Kath. So I will endeavour to talk a lot more about other things that can help with women's health issues. I'll talk soon. Bye.